I think it's not only safe, but it's encouraged at this point in time, especially if patients aren't feeling their normal selves, or if patients have issues and pending surgeries or evaluations that need to be done. It's imperative that they trust their bodies, that they listen to their bodies and continue to care for their health.
We are taking standard cleaning precautions and heightening them to an even higher degree. So we've always used industrial wipes here in the hospital, but now we're wiping down more frequently and more often. We'll get a temperature check upon arrival, and all employees are temperature checked. And we also wear our handy dandy masks just about everywhere. Things patients can do before they come in is just assess their symptoms, take your own temperature. If you have your own mask at home, that will save you about 2 to 3 minutes before you get your own mask here. If you don't have one, that's fine. We can provide one, but coming in the door with the mask ready. And if you're concerned about you having any COVID symptoms, letting us know early by calling ahead. Sometimes we can prepare a room for you in certain places. On our facility, Northcrest does feel that provider-patient contact, or at least being in the same room, is important. So we use PPE whenever possible, which is protective personal equipment. So we wear gowns, we wear masks, we wear funny hats sometimes, and even shields if we need to be, because we know being in the room makes the patient feel more confident. In instances where we can't be in the room because we're with another patient or far away, we do have iPads, which are equipped with video software, so we can conference with one another. I think everyone's done Zoom just about once during these times. So they're just like that. We'll have candid conversations, and whenever we can get in the room with you, we will.
I think it's safe. I would encourage everyone to continue to stay extra vigilant, take necessary precautions, continue to wash hands, maintain high levels of hygiene, and even wear masks in public places to ensure their own safety, but also to protect those around them. I think that the recommendations and the advice we're getting from higher up in terms of the CDC and the Department of Health are important. I think we have to continue to follow those and just continue to practice extra vigilance. Doing so will allow us all to move forward, hopefully in a timely fashion.
Patients are required to wear masks upon entering our facility, and if you don't have one, again, we will provide one for you. The best thing about everyone wearing a mask is masks prevent you from spreading the disease if you're an asymptomatic carrier, meaning you have the disease but just don't know it, and it prevents you from catching it from going in through your nose or mouth into your respiratory tract. So masks are important for everyone because it saves everyone.
Recommend to all patients that first and foremost, obviously, if they are having symptoms, and symptoms can vary from headache to fevers, to sore throat, loss of taste, generalized weakness. When they experiencing these symptoms, it's very important to get tested, especially when there's a high degree of suspicion of them having the coronavirus. I think another important point is whenever they have some sort of exposure, known exposure, whether it's family, friends, who they've been around, who ultimately have tested positive. I think those are the two most important times to get tested. Otherwise, I think in regards to the second part of the question, our emergency room test patients, and ultimately I know that the outpatient centers are having testing. whether it's physician offices or community places that offer that to the public. I know that if patients or people within the community call the hospital, they should be directed to the specific centers where they can go and get tested.